Thank you, and good afternoon. Today we have a total of 13 new cases who have tested positive for COVID-19 in BC, bringing our total in British Columbia to 3,128 people with COVID-19. That includes 1,015 people in the Vancouver Coastal Health Region, 1,649 people who live in the Fraser Health Region, 135 people in the Vancouver Island Health Region, 212 people in the Interior Health Region, 65 in the Northern Health Region, and 52 people who are residents from outside of Canada. We have no new healthcare related outbreaks. We continue to have 3 active outbreaks in the healthcare system, 2 long-term care facilities and 1 in acute care facility. We've had an increase of 3 cases in our healthcare outbreaks, bringing our total to 399 residents who have tested positive and 252 staff. We have no new active community outbreaks today, although yesterday we announced 1 outbreak in the Crazy Cherry Farm in the Interior Health Region of BC. We've also had, as you are no doubt aware, several community exposure events in the interior, particularly in the city of Kelowna. And if you have been at any of the locations where community exposures have been, we are requiring people to monitor carefully for symptoms, limit your contact with others during this incubation period, and contact 811 if you have any symptoms at all. There has been as well direction from Interior Health for people who are in certain places to self-isolate during that incubation period. I do also want to remind people that food is not a source of transmission of COVID-19 for the most part, and in particular we are confident there is no risk from cherries that have been processed at the Crazy Cherry Farm in Interior Health. The processes have been reviewed by Agriculture and the CFIA, and they are safe. And I will remind people that we don't have any evidence of transmission from packaging or from food, but that we should always wash things carefully and wash our hands. So we now have 209 active cases in British Columbia, of whom 14 people are in hospital, 5 of whom are in critical care or ICU. We have no new deaths today, leaving our total at 189 people who've died from COVID-19 and 2,730 people who are now recovered. With every increase in our activity, the potential for COVID-19 transmission increases as well. And we know that. We've known that as we've restarted over the phased approach that we've taken in the last few months. And the number of new cases of COVID-19 in the recent days is evidence of this. And we've had more than we're used to seeing in the last few days. This is not unexpected and is a reflection of a number of things. One is that we are getting out more, we are being more active, and we are, unfortunately, transmitting this disease. But we are also monitoring closely, and public health teams are actively working to manage every single case and make sure we find all of those close contacts who are at risk. We know there will be cases, but we need to ensure we can contact trace quickly, and that's how we all need to do our part to slow the spread and keep the cases to a manageable level so that we can continue to do the things that we are doing. We're now past that first incubation period since Canada Day and since we moved into phase 3. This means having a heightened awareness to symptoms is incredibly important. There may be other people out there right now who are at parties on Canada Day who had been in contact with somebody who had this disease over the last couple of weeks. And you may have mild symptoms. If you have any concerns at all, you can be tested anywhere in BC, and that's important right now. We need to continue to minimize our cases, manage them effectively with public health teams, and modify our activities as we need to do to make sure that we can continue to safely get out and about and open up. We absolutely can get out there and be active, but we need you to do that safely. And we know that we know how to do this here in BC. It is important to remember that if you have an underlying health condition or are older, you are at higher risk of having severe illness. And we also see from other places where they've had a surge in cases that the more people that get sick, the more likely there's going to be people who are going to have more severe illness, who are going to die from this. You may not be aware of the health issues of all of your family and friends. Perhaps they're not even aware that they may have a condition that makes them at high risk. But you can take precautions to protect them and to protect yourselves. Though remembering, wherever you go, we bring our risk with us. So if we've had a lot of people that we've been in contact with, we bring that risk with us if we're going to visit our grandparents or if we're going to visit friends who may have health issues. We know that COVID-19 symptoms can be mild, making it very easy to spread the virus to those that we're close with and those that we're close to. That's why it is so important that we all stay away, stay home, skip those parties, skip that travel if we're not feeling 100% well. That means that you will have the opportunity to go another day. We need to recommit to the basics of fewer faces and bigger spaces. And we need to stay away from those higher risk environments, or if we are in those higher risk environments, make sure that we're doing things that make it safer. And that includes staying away from closed spaces as much as possible. Outdoors is better than indoors. Keeping your group small. This is important whether you are inside or outside. If it's a house party, you may not know all of the people who are there, and you may not know the risks that they're bringing with them as well. There are a number of things that we have in place in restaurants, in bars, in places in our community to keep people safe. And these are not rules to be skirted. These are the things that we need to have in place to protect customers, to protect staff. The requirement in restaurants for no more than 6 people in a group is very important, and it's done deliberately so that we keep those groups small enough that they're not posing a risk to staff or to others in that area. It's a good guideline for our social interactions as well. And just like in a restaurant, that doesn't mean having a big group and splitting and table hopping and mixing. So in a private setting, again, you need to be aware that the more people that you're in contact with, then you are spreading your bubble wider, and that can increase your risk. So from the get-go, we have said stay outside as much as possible. Maintain your safe physical distance from everyone other than your close household bubble. This still applies. And when it's difficult to do that, we need to use those layers of protection that we've come to know. So making sure that we keep our numbers small, keep to address the risks before you. Think about how you're feeling. Be aware of the risks you are exposing yourself to and the people you are close to. And let's do the right thing, as we have been doing for ourselves, our loved ones, our communities, and the province. And let's, of course, continue to be how we have been, to be kind, to be calm, and to be safe.